Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights, delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Well, hey everyone, welcome back to the TechLink Health Podcast. I'm Dr. Sarah Saman, and today's guest is Anand Naik of SecureTech. So, the future of healthcare and life sciences is increasingly becoming more and more of a connected industry that relies on delivering health focused data over secure and efficient networks to ensure that clinicians and health systems have the necessary information to achieve optimal outcomes. On one end of the spectrum, the healthcare software as a service space, alongside growth in the Internet of Healthcare Things and Internet of Medical Things, will lead to a massive increase in solutions capable of producing key data points and meaningful insights. And on the other end of the spectrum, this will lead to increases in breaches that can lead to operational disruption, financial consequences, and erosion of patient safety and trust. And as we transition into the future of care, it's important to highlight how cybersecurity will help to develop and deliver on the promises of digital healthcare solutions and the deep tech that is powering this evolution. So, here to talk about all of this and more is this episode's guest, Anand Naik. He's the CEO and co founder for SecureTech, a global cybersecurity company which offers end to end security in the areas of enterprise threat monitoring, incidents response, device security, and identity and access governance through their own AI driven Percept Cloud Security Platform, or PCSP. Anand's experience within the cybersecurity industry spans executive leadership roles with notable companies such as IBM, Symantec, and Sun Microsystems. It goes without saying that Anand has deep expertise in cybersecurity, and we look forward to getting his perspectives on how this key area will impact the future of healthcare and life sciences. So, without further delay, we're excited to welcome Anand to the podcast. Anand, thank you for joining us today.
Thank you for having me, Shannon, and look forward to this conversation.
Thank you. And to start and to give our listeners some background, can you take a moment to introduce yourself in a bit more detail? Tell us about your journey into the deep tech space and cybersecurity and your subsequent focus on healthcare and life sciences initiatives.
Thank you. Hello, everyone. Thank you for joining this podcast. My name is Anand Nayak, and my IT career spans more than 3 decades. I've had the opportunity to work with some of the largest tech companies of their day and with some of the largest banks, manufacturing, healthcare, and pharma companies around the world to help them set up their business and mission critical technical architectures as they were evolving, and later help them in their cloud and digital transformation journey. I'm a practicing cybersecurity professional for more than 20 years and have very closely seen this space evolve technologically to help prevent and protect against the ever-changing threat landscape. Healthcare and pharma are among the most targeted industries by attackers for the past decade, more than the financial services and banking and other spaces. Our work at SecureTech for the past decade is helping our customers protect and respond to these attacks with our cutting-edge AI-driven Percept Cloud offerings.
Thank you for sharing your background. And this is such a timely situation that we're talking about with all of the security breaches that I think everybody has become aware of and the immense impact that these breaches can have. It's noted that the SecureTech mission within healthcare and life sciences practices is strongly tied to better visibility, protection, and response without the complexity. So tell us more about that mission in a broad sense.
So healthcare is the most attacked and targeted industries for the past 3 years. Last year alone in US, there were 113 million patient records which were stolen. The average cost of a data breach in the healthcare industry is around 10.9 million per instance. And this is increasing at the rate of 50% over the past 3 years. So massive incentive for attackers to keep on attacking this industry. And it is almost double than the financial services industry, which ranks next in line for the highest number of attacks. We believe that our AI-driven technologies provide the right solution to bring in the required visibility. The biggest challenge that environments have today is getting to know all the IT assets and all the medical IoT assets. So providing visibility in real time, helping through this visibility, helping detect threat, prevent and respond to this myriad of attack, which keep on targeting the healthcare industry is a very important aspect. And SecureTech PCSP environment, the Percept Continuous Threat Exposure Management Platform environment, along with our AI, allows us to process these millions of security signals that are generated across thousands of these customer devices, servers, IoT, and cloud environments in real time. So we believe that we have a very strong value proposition that not only helps you detect these assets in real time, but also helps you respond to it and also help you prevent against some of these attacks.
Fantastic. I just want to highlight what you said about 113 million patients. That's a lot of people whose lives are impacted, some in fairly small ways, but others in enormous ways. And we've learned recently that these types of breaches not only affect data, but can impact healthcare and delay important care. And just the sheer number of people, that the amount of money that is involved is really astonishing. So let's dig into some of the secure tech solutions that are helping to create a more secure future within healthcare and life sciences and how you're able to do that. And before we dive into that level of detail, let's also talk about cybersecurity and why it's so important to the industry. What are upsides and downsides of these transitions that we're seeing going from these multiple systems, some of which are quite vulnerable? And where are we at in this cycle of transformation, going to systems that might be better prepared and have stronger defenses against these really nefarious attacks?
Yeah, sure. Protecting PHI, PII, and other critical information has been the main goals for every IT infrastructure within the healthcare space. Now, if you look at some of the most common attacks and threats that are happening within the healthcare space, phishing, which is email-based phishing or targeted phishing attacks, continue to be one of the biggest malicious intrusions that happen within an organization. And if you're an employee trying to click something or a targeted phishing attack trying to install a malicious code into your environment, ransomware, data exfiltration, hacking, denial of services, these continue to be the key threat vectors that continue to impact healthcare environments. The other two or three important areas that are emerging in this space is vulnerabilities emerging out of unpatched systems. A lot of times these devices just continue to be installed, running fine, and people follow this, the golden rule of if it is running, don't bother and don't touch it. But when the attackers know the vulnerabilities sitting on those systems for years, and now they're exploiting it, patching those systems in timely manner becomes an important defense mechanism. To add to this complexity, you have medical devices that are connected in the IoT world. And these medical devices generate a lot of data that could be compromised or that could be used by the attackers to compromise not just individual patients, but also take down organizations. So when you look at secure tech solution and what we are trying to do, we address this in four different areas. The first and foremost through the Percept Cloud, like I mentioned earlier, it's an AI-driven solution. So everything that we do has AI at the core of all our offerings. And we believe that AI helps detect this in real time much better compared to the traditional mechanisms of signatures and rules. So we believe AI is the future to detect this kind of attack. Like I said, four things that we do. First is bring visibility to everything that is there in your environment, whether it is IoT devices, whether it is traditional legacy IT system, new generation cloud SaaS providers that come up and give solutions in the environment, hosted out of a public cloud or a private cloud. So bring visibility to all your important IT and medical IoT assets. The second thing that we do is collect security telemetry as well as security alert and event across all these devices. The millions of data points that we collect across thousands of devices within the environment. And then the AI does its magic, so to say. What it does is across real time scenarios of different types of attack and compromises and user behavior anomalies, the AI detects for these thousands of security events that come in, we detect any anomalies in the environment and thereby predict an attack or detect an attack before it happens or as it is happening. And should an attack go through it, the platform allows you to go and create an automated incident response so that you are able to go and prevent it. And most importantly, prevent data exfiltration and prevent important IT crown jewels, your data and information from going out of your environment. And to put it in context, the healthcare industry, on an average, takes 231 days to detect an attack, and on top of it, around 92 days to contain an attack. So we are talking about almost 300 plus days to detect and contain a cyber attack within a healthcare industry. So tools such as the SecureTech, Percept XDR, and PSIAM, and Percept Identity, they allow you to go and instead of waiting for 200 days to do it in near real time, or to bring it within manageable time frame so then you can go and respond in the shortest possible manner.
That's fascinating. I want to reiterate some of those numbers for our listeners so that it can take, on average, 231 days to detect an attack. So if your healthcare system has been attacked, this can be going on behind the scenes, all of this private information being made available to these people that obviously we don't know who they are, but they are not using this information for good. They're obviously collecting this information and potentially causing great harm to individuals and to the system. And this goes on for a couple hundred days and then 92 days, you said, to actually contain the attack. So once you even know the attack's there, it can take a few months. So you can just imagine the amount of information that's being leaked out, very private, personal, incredibly intimate information that is being leaked to people who clearly have only harmful reasons to access that information. You mentioned unpatched systems. When we think about healthcare, we know that healthcare is a lot of individual people with varying degrees of technological understanding. And so you've got people all the way from medical assistants who may just be right out of high school to physicians, CEOs, other people who are also accessing all of this information. You've got medical devices, as you mentioned, that are bringing more information systems. So all of this information is right at hand for these bad actors. We hear a lot of angst about AI, but we've had several other guests who have shown us ways that AI can be used for good. And I think this is a really great example of how AI can change healthcare for the better. It's quite apparent at this stage that leading organizations are focusing on these operational gains and improved efficiencies and patient safety aspects of cybersecurity, and patients are demanding that. And this will ultimately allow physicians and other healthcare providers to focus on delivering patient centered care and improved outcomes as the primary incentive model. On one hand, that's moving us towards a transformative shift that will lead to a more personalized approach to care. And on the other hand, there's this transitional gap between the current and future states where we are now, where we're hoping to be. With this in mind, help us to connect those dots from now with multiple different healthcare systems, multiple different technological levels of sophistication or lack of sophistication, and projecting out to, say, 2040, what can we expect to see as a result of these improvements in cybersecurity that Secure Tech and others are offering?
Sure. If you look at the healthcare IT ecosystem, there is this whole front office or the patient care, and then there is the entire back office, the entire healthcare ecosystem of different health tech providers, cloud providers. All of this today is disjointed. Each one of them are efficient in their own right and continue to deliver, but they are all disjointed. So the aim is to see how we can bring all of these systems together in a more cohesive manner, going back to what I mentioned earlier as an asset discovery, making sure that you understand the entire landscape, your supplier ecosystem, your supply chain ecosystem. And for that healthcare provider or for that care provider, you have the overall ecosystem understood in the right way. The second stage that happens once you understand all the security signals that emanates from all these different devices. So whether it is a user logging in at unusual hours to somebody logging in simultaneously from two different countries, putting a good identity layer and managing identities in an effective manner is the second step. So once you have the asset discovered, you look at the identity layer, you make sure that you follow this principle of no one having access to the environment unless needed and only when needed. So you go through this, what is called the zero trust principle on identity, and put a complete identity governance mechanism in place so that you capture anomalous behavior of people trying to log in or attackers impersonating some employees or supply chain staff. The third stage is to look at all these different signals, like I mentioned earlier, different security events. Look at whether there is a pattern emerging for a network attack or an attack on individual devices or attack on somebody trying to impersonate on the cloud. So look at different types of attacks ranging from phishing that I just mentioned on compromised credentials or different malicious attack patterns and that kind of thing. So you detect these patterns in real time. Again, try and find anomalies in these patterns based on information from a global intelligence perspective, compare it with your environment. So you discovered the asset, you brought visibility of all of that, you made sure the identities are addressed, and I follow principle of zero trust, then get it to detecting all different types of attack, malware, or any other attack patterns that emerge within the environment. So you do that in a proactive manner through a continuous process of discovery, detection, to protection and prevention. So that's what the future would look like. You will see emergence of Gen AI and large language models to address some pieces within the environment, but essentially creating this homogeneous environment across a heterogeneous set of pieces that exist today, like I mentioned at the beginning of this conversation, where you use AI and different types of small and large language models to different pieces of this puzzle, but working across the heterogeneous environment, because we have to remember that patient care and healthcare in general will continue to have its own technology evolution, and the role of IT and the role of a security system will need to be to embrace this heterogeneity and try and bring it across these homogeneous layers that I just mentioned.
That's such an important point about the heterogeneity of all of the devices and programs and different aspects of healthcare that are interfacing with each other. And we've got all kinds of entry points where things can go wrong. And we hear frequently that it may be a clerk making a simple mistake, downloading a simple document that he or she thinks is something that they're supposed to be doing. And all of a sudden, this sets off this enormous disaster. It's really horrible and evil. And yet, this is the world that we're living in. So we need the type of services that you offer. And you mentioned AI being able to detect the patterns that are happening, prevent the problem, I'll also respond. quickly. One of the trending topics across industries is Gen AI. So tell us about your work in that space and the opportunity for use cases within healthcare and life sciences. And also, given your positioning as a cybersecurity solutions partner to notable organizations, tell us more about some of the partnerships that are centered around helping to evolve Gen AI use cases in healthcare and life sciences.
So Gen AI is like a vast area. At SecureTech, we are focused on four specific pieces and leveraging Gen AI and AI in general. The first is, can I use large language models or Gen AI models as they're called for productivity increases? For example, I mentioned a lot of data gets generated, a lot of millions of pieces of security data gets generated for different customers. Can I use, instead of the traditional search mechanisms, Gen AI to use and eliminate the traditional search and just use natural language processing models to generate search? Instead of typing some complex piece of search query, to just mention and ask, hey, I need to know what kind of patterns that change or what kind of attacks I was subjected to over the last 30 days in my environment, or what are the top 30 attacks happening in the world in the healthcare industry today. So using AI model to increase productivity, like eliminating the need to create complex searches and using natural language models to replace the search engines with. The second is in the response area. Incidents are bound to happen. It's not a question of whether you will be attacked. It's a question of when you will be attacked. And the important piece that you will have to remember is when you are attacked, are you equipped enough to detect this attack and to respond these attacks in real time or as quickly as possible? And I believe Gen AI and the work that we do at SecureTech in incident response is going to be critical to go and create the right responses. The third is cybersecurity has a lot of skills gap today, and Gen AI can be used definitely to look at basic mundane tasks such as report generation or query response or some good basic tasks where the skills gap can be addressed more efficiently with Gen AI. And finally, some of the pieces in the operations and application security space where large language models can be used. But I would like to also point out, while large language and Gen AI has its role within the security space, the core detection and the core identification of threats of different nature and different types, I mentioned earlier, generic categories of web attacks and network attacks and user behavior anomalies, entity anomalies. These will require specific targeted small language modules. So in the AI world, there's both these species of large language and Gen AI, where security companies and companies like us can play a bigger role in using it efficiently. And then there's this world of small language models, which are very targeted, very specific, solving specific problems and specific needs. And we believe that both will coexist and both should coexist so that one delivers the special work and the other makes sure that the generic tasks are solved more efficiently, like the search that I just mentioned.
So it's clear that we need people with expertise in these areas, and we need systems that are being developed to detect these. This isn't something that a given healthcare organization can necessarily do on their own. The complexity is enormous and it's only increasing. So these emerging technologies are such an intricate part of the future of health, yet still in an early stage with respect to technologies such as AI and machine learning, alongside their abilities to interact with various devices, especially medical devices, wearables, other health tech, things that keep being developed. There's something new all the time. And it's well noted that there are positives and negatives to the proliferation of these technologies, with one concern being around data bias used in AI models alongside cyber threats. So tell us more about your perspectives here with particular regards to health safety and trust and potential challenges as well as opportunities with emerging tech such as the Internet of Healthcare Things and Internet of Medical Things or IoHT, IoMT devices. And what also are the top areas of focus where technology can help to create a more equitable and secure future in healthcare for all of us?
So when you look at this entire environment that you just mentioned, IoT devices and the IoT world, massive investments, massive changes happening in that IoT world today. And just to point out some numbers, we are talking about close to $280 billion in 2024, massive adoption of IoT devices in pharma, healthcare being one of the leading sectors along with manufacturing where this is being used. So three things that are happening there. First is regulators such as NIST, National Institute of Standards and Technologies. They have very clear guidelines around IoT security, which cover three critical areas of risk mitigation. The first is device security, to protect device security. Second is data security. And third is individual privacy. When it comes to individual privacy, you have also regulations such as HIPAA and HITRUST and GDPR, which also focus on PII and PHI data. But one important piece that we need to consider when you are looking at data security and device security is these IoT devices often end up connecting to cloud and to mobile content computing environment for configuration, for monitoring and management, for data exchange, for patching, and for troubleshooting purposes. So these devices not only work in isolation, but also connect back to the cloud. And this leaves them exposed to all threats that affect the traditional IT and the cloud environment. So we have to take this into consideration when you are looking at the life cycle of IoT security and medical mobile security that you touched upon is these various stages of identifying these assets, which I touched earlier, to assessing the risk, medical IoT risk for each of these assets, applying different policies so that it can prevent the risk or reduce the risk, as well as prevent known threat, applying your standard IT policies so that you can incorporate it as a part of your vulnerability management life cycle or as a part of your patching life cycle. And then finally, integrate the security data that gets generated into your corporate security monitoring tool, where you are able to bring in all these IoT security data back into the environment. Following this five-stage approach of identifying the asset, reducing the medical risk around it, applying different policies to preventing against known threat by patching the vulnerabilities and identifying them, and then to look at the data being spread into a larger system so that you are then able to detect and respond to unknown threats. So that entire ecosystem is something that one needs to be ready with and create it, keeping these three tenets of device, data, and network security at the core. The second big piece that one needs to look at is typically you will find medical IoT devices are in isolated locations. For example, an MRI machine or some other monitoring machine. These are in isolated location because it requires those specific environments under which they are operating, isolating and segmenting this network where these machines are deployed so that you create kind of an air gap environment for these critical devices. It will help reduce the traditional IT threat actors from gaining unauthorized access to them. So isolating these environments, creating air gap or network segmented environment is again a critical concentration. I mentioned authentication earlier, and I want to re-emphasize that enabling authentication by removing simple things like a common password or a hard-coded password on the firmware or weak passwords. And an important element that needs to be added on top of it is this whole ecosystem interfaces, updates and patch mechanisms that do not disturb the environment. All these various aspects, including hardening and critical systems, need to be considered when you are looking at the entire IoT setup and different models that you are working on around it.
Those are great points. And just the simplicity of passwords, being mindful about the way passwords are used and passwords are shared. Healthcare tends to be less about technology and more about caring for the patient. And sometimes it seems like a lot of trouble to go through to keep changing passwords or not sharing passwords, but clearly something that simple can lead to a tremendous breach of security and impact on patients' lives. And then, as you said, keeping up with updates, things that are simple but might seem to be a nuisance, things that are very practical. These are things that people can implement and should implement, and I think must implement no matter what healthcare system that one might be working within. So thank you for those valuable insights. And then moving on to more of an industry perspective at the organizational level, from a cybersecurity perspective, what advice do you have for CEOs that are harnessing the power of health tech from both the perspective of innovators and startups that are creating tech to larger organizations that might not be able to move as quickly, but still stand to gain from the advances in technology?
A great question. So what's happening today is cybersecurity is a broad topic. It is in regulated industries such as healthcare. It is mandated by regulators to bring up the security posture and the risk posture around cyber as a part of your board conversation. Now, what this will fuel and drive is a lot of innovation in the space because the world is going through probably one of the most innovative periods, whether what people call Industry 4.0 or generative AI or the entire use and exclusion of AI in different assets or plans. Health tech is also harnessing this power of all the changes that are happening around using AI in different fashion or bringing in different aspects of newer technologies that Industry 4.0 revolution is bringing into the environment. So CEOs definitely will have to look at how you can bring all of these together. Now suddenly you are exposed not just for your environment, but exposed to a larger supply chain because of these health tech companies, cloud providers, different innovations happening in different pieces. We suddenly now have a large third party exposure because we have a larger supply ecosystem, which is harnessing this power of new technologies. So CEOs will have to be mindful, bring this risk of the supply chain integrated into the conversations that they have with their IT folk and with their tech folk. The second piece that they definitely will have to look at is as they embrace these newer technologies because it is going to be business beneficial for them or provide better patient care or provide better intelligence around patient care. As they bring in this aspect, they will have to get mindful of some of the risks that get associated with it or come along with newer technology adoption and how that risk can dovetail into their overall risk posture is going to be a critical element for them to look at. And clearly, not embracing is not an option here. People are going to be looking at newer technologies to deliver better healthcare, making sure that there's enough awareness and education created among not just your employees, but across your supply chain ecosystem is going to be critical now for the CEOs and for the boards to look at. But like I said, the regulator is already posting security and secure environment as a part of the larger business risk. It is already there as a boardroom conversation. So embracing it and making sure that you consider these factors of supply chain, third party, internal risk and education, all of these together as you embrace this is going to be critical.
Excellent. So we have to get everybody on board, and this has to come from the top down. So switching topics a bit, let's talk about consumer health tech and devices. We touched on that a bit already, but on a personal note and from a consumer perspective, what are your favorite picks for healthcare technologies that are leading maybe in the cybersecurity space?
I think the most common, if you look at type 2 diabetes, is one of the most common diseases, lifestyle diseases that people today are faced with. And those gadgets that you put on your arm, who instead of dispensing medicine, the traditional way of dispensing the medicine was to take the tablet. Today, you are connecting a device here, which is not just monitoring your glucose blood sugar levels, but also dispensing the medicine as is needed. And innovations around that space, or even innovations around pacemakers and some of these other IoT devices, in my opinion, has really been life changing for patients because now instead of letting the medicine sit in your body and do effect for 12 hours or 24 hours, You are just taking the right quantity at the right time when it is needed, and thereby giving you a better life. So we have lots of favorites. I just read about the open MRI machines that are coming out with a lot of IoT components built into it. So a lot of good innovation happening.
That is really exciting. And when you think about that, I think a lot of people take some of the innovations that we've had over the last few years for granted, but pacemakers, it's incredible the technology that's under the hood. They may look like the same as they looked 10 years ago on the outside, but on the inside, it's really astonishing what pacemakers can do and the improvement in diabetes care. And yet, all of this creates more vulnerability. So, all the more reason to pay attention to what's coming along in healthcare tech and healthcare security. So there's so much going on in healthcare innovation and health tech that it is difficult to hone in on all of the developments. So this also promotes and provokes the thought of what are we missing? So from your perspective, what are we not talking enough about that we probably should be?
So and every innovation, when it comes in the market, is costly and therefore affordable to only a few people. And the part, in my opinion, that we need to start changing is from day one. How can I make that innovation affordable to the poorest? By the time this fancy new innovations, where it is required the most, we have lost so many years and so many decades of innovation that existed. So I think if there is a way and a mechanism that IT, technology, AI, all these different pieces that we just spoke of, if there is a mechanism to take that innovation to the lowest denominator from day one, I think they would do a great service to the world.
That's really a beautiful point that these innovations in technology shouldn't just be for a small subset of the world, that we can really change people's lives with what we have available. In closing, any final recommendations for people that are interested in staying connected to your work within the deep tech and cybersecurity space, and any key points that we didn't cover that you'd like listeners to know? And then finally, any topical recommendations such as books or other content that you think would help our listeners?
So I think for keeping in touch with us, we are present in US in many cities that are headquartered out of Arkansas as well as in Princeton, New Jersey, with location in the Bay Area, Illinois area, Boston, Dallas, everywhere. And check out that website or social media posts and use the innovation that we do within the security space. All of it is available on our website. So many ways to reach out to us. I think that we are doing some really cutting edge work, and we believe that it will definitely serve better in the healthcare space and humanity overall. And we want to make sure that all 500 of our people focus on delivering and protecting the world every single moment, every single day. I think we covered most of the points. I just want to reiterate that health tech and healthcare in general, coupled with health tech innovations that are happening, gives a lot of room for attackers to gain access if you don't plan it properly or if you don't architect your solutions properly. And that is something that we would want to make sure that people keep in mind. We already covered the boardroom discussions that these topics already today enjoy a space and have a space in the boardroom conversations with CEOs and the board. Making sure that the risk is captured efficiently and treated efficiently is important. I think there are lots of good books today available. More than the books, there are lots of good blogs available on innovation and innovative technologies where people can get themselves educated further. I enjoyed having this conversation with you. So thank you for that.
Fantastic. Well, thank you so much. My guest today was Anand Naik of Secure Tech, and we really appreciate you coming onto the show.
Thank you.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.